Welcome to the Putting the Public into Health podcast by Dr. Richard Pan. As we face one of the greatest public health disasters in the century, this podcast will address questions and issues from you, the public, about the COVID-19 pandemic and its impact on people's health and lives. I am Dr. Richard Pan. I am a physician with a background in public health, and I am proud to represent the people of Sacramento, Elk Grove, West Sacramento, and parts of Sacramento County in the California State Senate. I want to share with you important information and stories to help each other during this difficult time. Black Americans have worse health outcomes than other Americans as a result of systemic racism. The COVID-19 pandemic has highlighted both the health and socioeconomic disparities suffered by Black Americans. I am honored to have Larry Lee, publisher of the Sacramento Observer, join me. Founded by his father, the Observer newspaper is a leading voice for the Black community in Sacramento and our country. Larry is an influential Sacramento business and community leader, and I am honored to have been in the same American Leadership Forum class with Larry. Thank you so much for joining me, Larry.
Dr. Pan, thank you for having me.
As one of the nation's leading Black newspapers, the Observer has made health a major focus. Why is health so important for the Observer?
Oh, why is health so important for everybody, Dr. Pan? I think if you don't have your health, you have nothing, right?
That's what my mother said.
Yeah, I mean, you can't serve, you can't enjoy life, you can't raise a family, you can't do anything without good health. And I think, the pandemic has exposed, among other things, has exposed the disparities that African Americans have faced with health, overall health and health care and medical care. Let me say it like that, with health care and medical care. And I think that, we as a newspaper have always tried to make sure that we shine a light on trying to address those issues. We've tried to work within the systems of healthcare systems and medical systems to try and bring information to our community. It has often been a challenge. If it was easy, everyone would do it, but it's not easy. So we try really hard to make sure that our community can be the healthiest and have the most vitality it can have for its life.
Now, Black Americans on average live 4 to 5 years less than white Americans, and we've even seen Black celebrities who have fame, wealth, still suffer from poor health outcomes. How is the Observer reporting on health disparities like that difference in life expectancy or other health disparities as well?
Well, I think it's been a number of things. We've had an ongoing health section that we've published over the years called Vitality that has addressed everything from, and I make a distinction between health care and medical care. And you're the doctor in the room, so you can probably correct me. But I think that there's health care areas where there are a lot of social determinants that impact our health care, whether it is access to a good grocery store because you're in a food desert, the transportation challenges that you might face going to and from work and not being or living in an area where you're unable to go for a walk and with regularity, or living in a community where you might have electrical towers in your backyard, or different other social determinants that impact your ability to have a healthy lifestyle. Many of those things are not, we oftentimes try to make them seem like they are choices. Many times, though, for our community, they're not choices. They are results of the environment in which we live. You mentioned where, on average, Blacks live 4 or 5 years less than white Americans. But if you go to particular zip codes in particular communities, that number can be as high as 10 or 12 years of a disparity. And so we've always tried to make sure that we address the healthcare aspect of that. Then flipping the coin to address medical care is an entirely different beast, right? You start talking about medical hospital coverage and how it impacts our community. Everything from access to medical care as an employer or as an employee and wherever you work, to even once you go see a doctor. Oftentimes, when African Americans say they have ailments, many doctors brush them off and kind of suggest that it might be something else, and then you overlook something that is critical, and even something as simple as I dealt with this a lot with my dad, was being able to have an advocate on your behalf when you go to the doctor. Who can ever really have someone, a loved one, go with them to the doctor to help advocate on their behalf, because those other people might be working or might be in jobs where they are unable to get away. Mm-hmm. So I think the medical care and health care are two of the areas that we've definitely always tried to shine a light on, raise the awareness, let people know about the disparities, and we've done some other boots on the ground type things. We've had events, healthcare events and the like, that have also tried to connect the healthcare industry with our community as well too. But it is an ongoing challenge, and it's those social determinants are so impactful on our community, and we've got to make sure that we continue to address that.
No, I really appreciate that. As a physician, when we talk about, we make recommendations to people, right? You need to exercise, you need to eat better, and I've tried to point out to my trainees, don't just tell people they need to exercise, ask them whether they would exercise, because the answer could be very enlightening when they tell you that, well, the park isn't safe, I'm on a second floor apartment, and I'll get kicked out if we make too much noise up there, jumping up and down, and the only place I can buy my groceries is, they don't have fresh fruits and vegetables. So it's not, mm-hmm. You're right, it's not a choice. It's based on their circumstance. They may not be able to do the things that we're recommending people do to try to stay healthy. Now, at the same time, sometimes people talk about these health disparities as if they're immutable or we can't do something to change. But in fact, for decades, Black infant mortality is twice as high as that for other infants. But 7 years ago, Sacramento County began an effort, the Black Child Legacy Campaign, which actually resulted in almost having Black infant mortality. And then actually reduced the disparity by 76%. So basically, if you actually make a concerted effort, you can close, at least narrow, we didn't entirely eliminate it, but narrow that disparity gap. What does this campaign tell you about what we should be doing to reduce health disparities?
Yeah, well, I think I'm extremely proud of the Black Child Legacy Campaign. As I've told many of the leaders who were involved with helping to pull that together, that from my perspective, that commitment was one of the most important commitments ever made to the African American community in this region, to really address those disparities. I think, and to your point, the data is starting to reflect and show that, when we call it what it is, mm-hmm. and really put resources behind policy, that lifestyles and outcomes can change. I think if there has been a failing by systems for generations, it has been the inability to commit resources appropriately and equitably to our community. Particularly in California, right? We're in a post Prop 209 era where you cannot discuss race, or you can't have data based on race or other challenges. And I think it is so critical. The Black Child Legacy Campaign is called that for a reason, right? It's not the People of Color Child Legacy Campaign. It is not, the underserved Child Legacy Campaign. It's the Black Child Legacy Campaign because those disparities have been impacting the Black community and Black children. And so that in of itself is Herculean to be able to just call it what it is in this state. And so it can be done if we allocate resources, have strong advocates with courage that can step up and say, and even it doesn't have to be from the African American community. I mean, obviously the Black Child Legacy Campaign was triggered by Supervisor Phil Cerna. And so it doesn't have to be from the African American community, but we have to have courageous leaders like that can step up and say, this is concerning for us, and impacting when something impacts an underserved community, we got to call it what it is. Mm-hmm. And so I've been very proud as a newspaper, to report on those issues. We were involved very early in the planning discussions on the Black Child Legacy Campaign, and have very proud of the work that many of the community navigators have done, because that also impacts how this works. That has helped fund and add capacity to those organizations that are on the ground doing the work. I oftentimes am in communication with county and city and state officials, and they oftentimes don't really realize the resources that are on the ground with community-based organizations, and many of whom are doing amazing work with little to no resources, little funding. And, if we can help support those organizations that are doing the work on the ground with resources and funding, they can stand up on their own and do even greater work for our community. So very excited about how that's gone, and hopefully that work will continue for a while.
No, that's great. Now, we are in the time of COVID. There's been a significant race factor related to COVID. The spread of the coronavirus for my community has been accompanied by a rise in hate incidents against Asians and Pacific Islanders.
Absolutely.
However, if you actually look at the disease itself, it's disproportionately infecting Latinos, so they're being infected at a higher rate. But in terms of deaths, Black Americans are the ones that have been suffering most. As I mentioned before, death rate, even in California, twice as high as any other group. So how is the Observer covering the COVID-19 pandemic, given its impact on not only the Black community, but all communities of color?
Sure. Well, this pandemic has impacted, our newsroom for sure. Not necessarily, on the ground. We've been a very safe newsroom, thank goodness. But newspapers in general have been impacted by this. Right? You're talking about the shutdown of distribution sites. You're talking about, pulling back of advertising. That is our lifeblood. And so, but the interesting thing is for the Observer, we over the last, 5 or 6 years, we've made some challenging decisions internally to try and begin to prepare us for hopefully what we feel is another generation of media information services. And so, the pandemic, while has impacted newspapers like in this region, the Sacramento News and Review, which was suspended publishing during the shutdown, we have actually been able to shift a little bit. So while our print product, we're still printing every week and still distributing, and we have, in fact, have had an increase in subscribers getting the newspaper, subscribing to the newspaper through the mail service. We have also increased our digital engagement with our audience and content. So we have, whereas before the pandemic, we would do a weekly email that went out to our community and our audience and our subscribers, we now have turned that into a daily one, right? So, and with every day, we have data and statistics for the county on how the coronavirus is impacting this region. We have obviously tried to continue to not only bring stories that kind of show the data impact, but also those that are doing the work to try and help address the vulnerability of our community. I think what the coronavirus has done has really exposed all of the disparities that are impacting our community, whether it is in obviously in healthcare and medical care, education, distance learning, technology, transportation, economics, home ownership, housing, all of these disparities that that we've been speaking to for the last 57 years are really being exposed in a way that is tremendous right now. So, we've tried to definitely increase our engagement. We we launched a webcast series called Coping with COVID, where we've addressed some different areas, related to the coronavirus. That was something that we were kind of working on before everything hit. Then when everything hit, then the Zoom explosion, I say that in quotes, the Zoom explosion happened and everyone started doing everything via Zoom. So we kind of took a step back just to make sure that we weren't falling into kind of this pile where everyone is getting overwhelmed with Zoom. So we've kind of produced our webcast to reflect and look more like a television show and a news show, where we do at the top, we do a recap of the news story, bring on some guest speakers to address different issues, and we have an engaged audience that we can also ask survey questions to and get response from them, and they can ask questions of the panelists. So we did one about a week or so ago related to distance learning and the impact that it is having on our community during this pandemic. In fact, you were on my short list of people to call to bring on to kind of talk about the healthcare disparities that are impacting our community as well too. It's just so vast, and I say the technology part because I think that is the next big thing if we don't get our arms around closing the digital divide and impacting our community in a way that is equitable moving forward. We are going to be in big trouble, because if the coronavirus has exposed a lot of things, but if you do not have access to technology, broadband internet capabilities, you are in trouble. You can't get medical care. I mean, we're talking about telehealth now. We're talking about, access to shopping because you can't go out. Where are you going to get groceries from? All of these things are going to impact us in a way that that gap can get really, really wide and really scary if we're not very careful and very intentional about helping to close that digital divide. So I think, as a newspaper, we've adjusted, and I think the thing that we're using internally is we're trying to make sure that we're very nimble as a news media outlet. That's where we were before COVID. COVID has reinforced that direction, and so it's been encouraging to see some of the things stick the way that they have. Our digital and social engagement has flown through the roof, and so we're very excited about the possibilities of being able to communicate with our community in a 21st century way.
Wow. Well, that's great. Finally, I did want to just talk to you about a dilemma that sort of illustrates some of the challenges faced by by actually Black men. So as a public health person, we are recommending people wear masks to try to slow the spread of coronavirus. But for many Black men, they are weighing the risk of catching COVID versus the risk of being targeted for wearing a mask, for having law enforcement called on them, for being accused of things. People have seen a Black man in the mask and called the law enforcement or expressed fear. So how do we navigate this?
Yeah, I think you bring up an exceptional point. And this is one of the reasons why I think the uniqueness of the Black press and the Observer in particular is so critical during this. There are areas of expertise that we have, that the Black press has, from having covered our community as long as we have. There's a different perspective that we have on just about everything. And they can seem like nothing in the general audience, but for our community, they mean different things. You're a healthcare, you're a doctor, you know these types of things. So when we talk about, which is going to be a very strong subject moving forward, vaccines, right? That resonates with the African American community much differently than it does in the general audience. We have trust issues related to getting tests and getting vaccines, and they are fully justified when you look at things like the Tuskegee experiment and others that have impacted our community. So we're extremely skeptical when it comes to that type of thing. So having the ability to communicate that with our audience is a skill set that is extremely unique to the African American, to the Black press and African American newspapers. Talk about contact tracing and how, finding out who people have been with and where they've been around, if they've been exposed to the virus. That's extremely critical for us as a community, for a general community, but for the African American community, that's gonna have different sort of ramifications for us. And to your point about the masks as well too, how we are perceived wearing masks, covering our faces, and not even just that. I mean, I think that there's definitely the profiling component that comes with that. But then you even flip the coin to the other side and say, let's say you don't have a mask on and you're walking into an establishment that is requiring a mask, and you don't have one. Now you're confronted with, someone in quote unquote authority at an establishment that is saying, we need you to wear a mask, and you're saying, I don't have a mask. And now what becomes now, you've now created an environment where, you've got someone who may feel like they have authority, and they can either, use that authority against you or call in, law enforcement or security or something like that. So you're going to have a different level of engagement with our community than we've had before. And I've had, we were part of a discussion for an open letter that went from the African American community to local city and county officials. And the part that you just brought up about wearing masks was one of our critical points, trying to make sure that that is not something that is held against us, but is encouraged and supported, because we want to make sure that our community is safe. And so, I've been in discussions with local leaders some of whom are looking to see about trying to even mandate that we wear masks and then enforce that. And as I told one of our local leaders, I said, you can't ask people to enforce something like that. You'd be better served by saying, look, in this, we've created, pickup stations for people to pick up masks for free, and we're encouraging people to wear masks. Please wear them all the time, and we're going to make sure that everyone that's wearing a mask is properly supported, and we're not going to have, those biases against them, and we recognize that everyone's going to have to wear a mask. So it's a real challenge, but I think that having forums like yours helps to discuss that and address that.
Yeah, well, just one small example of the myriad of issues that face actually all of us, because the dilemma comes from our reaction, right? Some society's reaction to whether the person is not wearing the mask or if they are wearing the mask. It's a no-win situation for a Black man. So we need to recognize that and change that environment so it isn't a no-win situation anymore. So,
right.
Well, thank you so much, Larry, for joining me. And I want to thank you for listening to this episode of Putting the Public into Health by Dr. Richard Pan. If you have questions or ideas for a future podcast, please email them to senator.pan@senate.ca.gov. Please stay at home as much as possible. Stay at least 6 feet away from others outside. Wash your hands frequently and try not to touch your face. Together, we are slowing the spread of the disease and saving lives. Thank you so much for listening.